Welcome everybody, and happy Thursday. I am so glad that you are all with me today for our very important and informative webinar about the updated CDC guidance for licensed childcare programs. First off, I just want to thank everybody for being cooperative with me. We were scheduled to do this webinar on Tuesday, and I had some life happen and had some situations I had to take care of in my own schools that kind of took priority, for me on Tuesday. And so thank you for being cooperative. But I got a lot of feedback from a lot of you that said today was better. So the universe was looking out for us, and it just worked out. So, today is Thursday, March 25th. I always like to give the date that we're doing these webinars because things are changing so often in our world, and we are expecting some additional guidance and update from different regulatory agencies, any day now. So it's always important to let everyone know what day we're talking about. So there you go. I'm kind of letting everyone get logged in. I see a lot of people popping in and saying hello. So hello to all of you, and thanks for joining me and always being there to support us and support the children and families that we're working with. I'm very optimistic about the time that we're in right now. I'm very optimistic about the future of the childcare industry here in Texas and across the country. We're not out of the woods yet. All right, and I can't stress that enough, that I know that we've got vaccines that are becoming more and more available every single week. We have more and more employees that are getting vaccinated, more families that are being vaccinated, the adults in the families that are being vaccinated. It looks like cases are, going down a little bit. But I just want to remind everyone that we still have a couple of big obstacles ahead of us that we need to be concerned about. We just got done with spring break. So y'all might have seen on TV and social media that we had a lot of people that decided to gather over spring break and probably did not follow CDC guidelines and local and state and federal guidelines for COVID. And so, it's very likely this week and next week we're going to see a spike in cases because we did have a lot of people that decided to gather over spring break. So we've got that obstacle that we need to be aware of. We have graduation season coming up, and a lot of people didn't get to graduate last year. And so this year, people are probably going to go crazy with graduations, and once again, probably going to gather. And we, probably will have people that won't follow guidelines and won't follow safety measures. So once again, we've got a big risk of exposure and increased cases. Then we got Memorial Day. Same thing, it's very likely for people to gather. Then we roll into summer, all right? So even though we're optimistic and, it appears that there's light at the end of the tunnel, we still need to be very careful because we've got a lot of risk still ahead of us, all right? And even though more and more vaccines are becoming available for folks, we're still at a very, very low percentage of people that have actually gotten it or that chose to get it. And, we still have a lot of risk right there. So my point, don't let your guard down. We've got these updated guidance from the CDC that we're going to go over today that are dated March 12th of 2021. So even the CDC realizes we're not out of the woods yet, all right? We still need to be very careful and follow some enhanced health practices. All right, so let me see if I can do this really quick. Now, for those of you that were not able to look at the updated guidelines. I posted the link right there in the chat section. I also posted it the day before yesterday so people would have a chance to review it as well, all right? Where we're gonna kind of talk about some of the major points in here. I am not going to go over every single page of these guidelines because you can tell that it's pretty thick. There's a lot of stuff in here. But here's some of my takeaways on these updated guidance from the CDC for child care programs. Those of us that are operating in the state of Texas, this should be our moment to be pretty proud of the state that we live in and the minimum standards that we have for child care programs. If you have been following the child care minimum standards for 20, 30 years, like most of us have been doing, 95% of what is in these the guidance from the CDC are things that we've been doing here in Texas for 20 plus years, all right? It was actually very interesting to me, the number of items that are in these guidance that I'm like, this is what we do every day, all right? And you know, but you got to remember, these are federal guidelines, and so not all states have awesome minimum standards like we do, all right? So, you know, nothing that we're going to talk about today is going to rock your world. Those of you that have been following the CDC guidelines for the past year, those of you that have been following the emergency orders from Health and Human Services here in Texas, those of you that have been trying your hardest to follow the governor's health protocols that came out last summer, this is nothing, all right? You got this, all right? So again, nothing really is gonna rock your world right here. All right, now with all that being said, we are still, as of today, all right, March 25th, 2021, we are still under emergency orders from Health and Human Services. That has not gone away. And I've been seeing a lot of comments on other Facebook pages about people talking about no longer following the emergency orders. That when the governor lifted the mask mandates, he also lifted all of these other things. Guys, the emergency orders that we are under are from the Commissioner of Health and Human Services, all right? They did not go away. They are still in effect, okay? So that's very important. Now, in our emergency orders from Health and Human Services, one of the things that you will notice in here, those of you that have read it and you're very familiar with this, it does say in our emergency orders that we must comply with the guidance from the CDC, all right? So all of these updates that we have from the CDC on March 12th are applicable to all of us, all right, under our emergency orders, okay? So that has not gone away. It has not gone away. Of course, we're always following the child care minimum standards. That has never changed right there. And of course, we have our health recommendations from the governor's office that we received last summer. And so these are still in place as well. And the health recommendation from the governor's office actually were updated on March 10th as well. Okay, so if you haven't had a chance to review that material, you might want to give it a look over. Now, key word right here is recommendation, all right? These are just recommendations from the governor's office. You cannot be cited by child care licensing, you know, if you don't follow any of these recommendations, like the child staff ratios and the group sizes. Those are probably the two things that have come up most often. Even though they are recommendations, y'all know I've been telling you for a year now, follow them the best you can, all right? If you were to end up in a lawsuit, so someone were to sue you for catching COVID at your program. Now that's a very unlikely lawsuit, but it could and probably will happen at some point. The more you're able to show that you followed, the better off you're going to be. All right, but if you choose not to follow some recommendations, that could hurt you in a situation where liability is being questioned. All right, so want to make sure that everyone is aware that all of these documents are still in place. Now, with the March 2021 CDC changes that we saw, there are basically 9 changes that happened with the CDC. They expanded the guidance for the background of COVID-19 and how it is transmitted in a child care setting. So basically, we're a year into this, and most of us, especially here in Texas, we never closed down. Some people closed down for a little bit in the summer, but we stayed open. So we have a lot of knowledge over what COVID is like in our licensed child care programs, and the government has learned from that. All right. Of course, the risk for young children is very, very small. It's very, very different. The COVID risk for children is very, very different than it is for adults. All right. Even though the CDC recognizes that there is a very low risk for children catching COVID, and that it's not as deadly for children, what we have to look at here is not just the children that are in our licensed programs, but the adults that are working there. So we really have to take a strong look at our teachers, our caregivers, and of course the parents of the children. So a child catching COVID may not be as risky for that child, but it is a danger to the adult that is caring for that child. Okay, so that's why we have all of this guidance in place, is that you got to look at the whole big picture right there. But we have a lot more information about the transmission of COVID-19, especially in child care settings, and they're going to go over that in this guidance right here. Also, the use of masks. All right, now even though our governor in Texas has lifted the mask mandate, the CDC is still recommending the use of masks. Okay, so all of your teachers, your caregivers should still be wearing masks in your licensed programs under CDC guidance. All right, so I know a lot of people wanted to have a mask burning party when the governor lifted the mask mandate. Don't be burning those masks just yet. All right, your caregivers, your teachers should still be wearing these. All right, and in fact, the CDC is saying children over the age of 2 should also still be wearing a mask, especially if the adult caring for that child is in a high-risk category. All right. Now, everything that we're going to talk about today, I understand that you may not be able to meet every single, guideline that is listed here. It's very, very difficult for us to comply with 100% of this, all right? I've even got highlighted some things that I'm like, yeah, probably not going to happen, all right? But we need to try the best we can. And that's all we can do, okay, is do the best you can with what you've got, all right? Document, and if you're not able to follow any of these guidelines, make sure you're documenting why, all right? So what is the obstacle that's preventing you from following some of these guidelines? I think that's really important. We got to think about not only what is going on right now, but what could happen in the future, all right? Because y'all know I've been telling y'all for a year now that when we talk about legal action and risk and liability, I think that we're going to see all this pop up down the road. Not right now, but later on is where we're going to see it. So the more documentation you have, the better, all right? So there you go. I see a question if we recommend that a parent wear a mask whenever they're dropping off and picking up their child, I would assume. If you recommend that a parent wear a mask when they're dropping off and picking up and they refuse to do that, I'm going to go back to what's in your policy, all right? So once again, your policy manuals are going to be your best friend right here. If you write it into your policies that when a parent is dropping off and picking up their child, they must wear a mask, and you have that clearly posted, and they refuse to follow your policy, then you're going to enforce that just like any other policy in your book, all right? If you don't follow my policies, you don't come here, all right? So it's really simple. So if you write that into your policies that they must wear a mask when they are dropping off and picking up their children and they don't do it, then you dismiss, all right? So very good question right there, Tina, good job. All right, so once again, the guidance for child care programs from the CDC, this is going to be for all child care programs, whether you're a licensed child care facility, a family child care home, or a Head Start program. This guidance applies to everyone, after school programs as well, all right? Now they did give us a lot of additional resources for you to refer to whenever you look at that link. We're not gonna go over those today, but there's some good resources for you to go back to right there. In the introduction of the guidance from the CDC, one thing I wanted to just make mention is that they are going to refer you once again to your local health department. And that's one thing I really want to stress, you know, as we continue to go through this right here, is that even though we have the guidance from the CDC, your local health department is going to have the ultimate ruling here. Especially when you do have a positive case or you have an exposure. You're going to still follow your local health department guidance, all right, and whatever they give you. Now, we're starting to see that this is getting a lot more consistent than it was last fall. Last fall, you know, every health department was giving us different guidance. We're seeing a little bit more consistency, so that's good. But everything we talk about today, your local health department is still going to take priority right there. Julie is asking a question about, do children wear a mask when they're outside? We're actually going to talk about that here in just a little bit. That's actually in the guidance. I'll go ahead and answer your question since you asked it. You know, if you are mixing groups, all right, so if you have multiple different groups outside, then they are still recommending the mask being worn, all right? If you're not mixing groups and it's the same group of children with the same caregiver and you have a large enough playground that physical distancing can still take place, then you're going to do that at your discretion, because, you know, when you're outside running and playing, you got to weigh out the risk. What is the greater risk right here? You know, a child not getting enough oxygen whenever they're having some vigorous physical activity and passing out, or the wearing of the mask, all right? But if you are, you know, mixing children and you have multiple groups out there, definitely would recommend that right there, all right? Also, again, a big highlight with the guidance from the CDC is that the CDC guidance is meant to supplement but not replace any federal, state, or local health and safety laws, rules, or regulations. And that kind of goes back to what we talked about earlier. Our emergency orders from Health and Human Services are still in place, all right? These are just here to supplement. Our child care minimum standards are still in place, all right? This is just going to supplement. And of course, the health recommendation from the governor's office, they're still in place, all right? So we want to try to follow all of these guidelines to the best of our ability. Our emergency orders from Health and Human Services are in place until April 22nd of 2021. That is when they are set to expire, is April 22nd. Now, there is a provision in there that Health and Human Services can extend the emergency orders for an additional 60 days. So they could go until June of 2021 if they choose to extend those. Or they could be lifted at some point. I don't think it's going to happen, all right? Now, if I'm wrong, I'll be the first to admit that I'm wrong. I don't think HHS is going to lift our emergency orders. I probably get this question 2 or 3 times a day, and I think we need to continue practicing what we're practicing right now. All right, so the question about the mask is any child over the age of 2, anyone over the age of 2. All right, so again, it's going to talk about, a lot of our normal childhood illnesses. The runny nose, the sneezing is very similar to COVID symptoms. We don't want to let our guard down on that. I know a lot of us have had experiences where a parent or guardian has told us, oh, it's just his allergies, it's just his sinuses, and then 3 days later the child tests positive and now your whole school is exposed and you're closed down for 10 to 14 days. So we don't want to let our guard down on our enhanced illnesses right there. Same thing with your staff. So we still want to stay on top of that, make sure that, we're sending staff home that have some of the signs or symptoms related to COVID. Once again, you don't want to let your guard down. I understand, and this is where, I'm probably going to say this 20 times in this webinar. We're going to do the best we can with what we've got. Okay, and that's all you can do. And it talks a lot in this guidance about allowing staff to be out and being very relaxed on your policies for employees being absent and making sure that you have substitutes that you can call in when you have staff that needs to be out. I know, right? A lot of us are still struggling with staff, and especially as enrollment is starting to grow, we need more staff, and that's still the biggest challenge that we've had during the pandemic is having enough staff in our program. And then when you do have an exposure and you've got to quarantine 4 or 5 employees, that's hard, all right? So as I read through this guidance and it talks about having additional people, I know, I'm like, what dream world do you live in? All right, that's, sometimes not possible, but you do the best you can. All right. I love Amanda's comments. When parents tell us that it's just an allergies, hey, we're not doctors. We're not doctors and we're not nurses. We're just here to provide quality care and education for all of the children and families in our program. And I've got to make decisions that are in the best interest of the entire school. All right. It talks a lot in here about making sure that employees that are high risk, that you're making accommodations for them. Again, we've been doing this for the past year, so nothing really has changed right there. All right. Now, y'all know that on March 2nd of 2021, vaccinations were made priority for childcare workers. Yay! That was such an awesome news right there that the president kind of made it a mandate that licensed childcare providers and public school teachers be added to the priority list for vaccinations. And of course, the state of Texas followed along nicely right there. And I'm hearing a lot of you report that more and more of your staff are having vaccinations made available to you. There's a lot of resources that are out there. Licensing has been really good about sending us updates on helping our teachers get vaccinations if they choose to do so. So make sure you're staying on top of that, all right? We've been using CVS.com, the drugstore, CVS. And most of my people are getting in through CVS, and so it's been really nice. Just because a person has been vaccinated does not change any of these guidelines, all right? So that's really important for you to understand. Just because someone has been vaccinated doesn't make them exempt from anything that we're going to talk about today, yet. All right, that's where I think we're going to see some changes coming up right there. I got a question, how do we handle workers who opt out of getting vaccinated? That's going to be a completely separate webinar because there's a whole lot to say about that. And I want to try to stick to our topic, which is the CDC guidance that has been updated. But just a really quick answer to that, you got to be very, very careful mandating a vaccination because you could be violating several protected classes by making it mandatory, and you could get yourself into a lot of legal trouble by making it mandatory. But on the other hand, you also have to do what's best for your program, and your parents are going to feel more comfortable knowing that your employees have been vaccinated. So it's a double-edged sword. It really is a double-edged sword. I'm actually working on a document right now, and I will share it with you whenever I'm done. I'm going to roll it out next week, but a document that employees will fill out and sign whether or not they have been vaccinated, whether they choose not to be vaccinated, and kind of what the expectations are going to look like with that. And the reason why I'm drafting up this document is that y'all know the Family First Coronavirus Relief Act that was ended on December 31st, but then was extended until the end of March, where employees can get paid time off if they are forced to quarantine. That's ending next week, all right? And so if you have an employee that chooses not to get vaccinated and then they get exposed and they're forced to quarantine, it could lead to a situation where they're off work and not paid. And they need to be aware of that, all right? Because I'm hearing comments about people saying, well, I'm not going to get vaccinated because anytime I get exposed, I get sent home for 10 to 14 days and I'm getting paid. Well, everyone wants to sit home for 10 and 14 days and get paid for it, right? What they need to realize is that's ending next week on March 31st. All right, so if they want to continue to get paid, they might want to consider the vaccination so that they don't get quarantined. But that's going to be a whole nother webinar right there. All right, Tina, absolutely, you got to respect privacy. We do have privacy laws that are also in place, and so you cannot share with parents or other employees who has been vaccinated and who hasn't been vaccinated. So that is private health information, and you can't share that, publicly. So that's a very good question right there. All right, if you have not already updated your emergency preparedness plan with COVID-related material, so what you're going to do in the event that you have an exposure in your program, make sure that you're updating your emergency preparedness plan. They talk about that in this guidance from the CDC. All right. Again, we're getting a little off topic here. So I see another question about paying employees for quarantining. If y'all could please put a pause on these questions for another webinar. Let's stick to the topic of the CDC guidance. But just a really quick answer, Donna. You are required for paying them, but then you get tax credit. So you get to deduct that money from your tax deposits, your payroll tax deposits. But message me or call me if you want some more information on that. But again, it's ending next week, so you got less than 7 days of that right there. They're going to stress in the CDC guidance, and a lot of you have already heard this from your local health department, that exposure is being defined now as within 6 feet of being within 6 feet of an exposed person for a cumulative total of 15 minutes or more in a 24-hour period. So, when you do have an exposure in your program, that's a big question that your local health department is asking is, have they spent more than 15 minutes with the exposed person over a 24-hour period? And that's how they're going to determine if someone needs to be quarantined, all right? So you kind of want to start really looking at this, and I would even start some documentation. If you have a person that's stepping into a classroom and they're in that classroom for more than 15 minutes over a 24-hour period of time. So for example, when you step in to give a potty break, or when the director or assistant director steps into a classroom to coach or give guidance, to a caregiver, and then you end up having a child or an employee that tests positive for COVID. That director, that assistant director, whoever's giving that potty break, were they within 6 feet of the exposed person, and did they spend more than 15 minutes over a 24-hour period of time? If so, then you also are going to have to be forced to quarantine. So, once again, keeping the same caregiver with the same group of children every single day is still extremely important. We should not be mixing children, all right, in the mornings and the afternoon. You should do your best to keep the children with one group with the same caregiver. If you have different adults going in and out of that classroom, then you've just got more and more of a possibility of multiple people being quarantined, all right? And I would designate one person to be your potty break person, all right, instead of multiple people. So again, you're reducing the number of people that is spending more than 15 minutes within a 24-hour period of time with that exposed person right there, all right? They're going to talk a lot about respiratory etiquette and hygiene. So once again, really practicing measures of covering your mouth whenever you cough, proper hand washing tips for both the teachers and the children. Once again, we've been doing this all along, all right? Having hand sanitizer available for children over the age of 2 when soap and water is not available, having hand sanitizer available for your caregivers that they can use when soap and water is not available. So anytime they do feel like they have been exposed to bodily fluid, they've got the hand sanitizer that's there to continue to protect them, all right? Courtney, I do agree with you with your comment, and that's why I made the comment at the beginning of the webinar. Some of the things that are in here, yeah, it's not going to happen, okay? And we know that it's not going to happen, but that's why we continue to do the best we can with what we've got, all right? Because some things are not realistic right there. Make sure that you're still assisting the infants with hand washing. Once again, that's in our child care minimum standards. We still continue to do that. They're going to go over when children and employees should be washing their hands. Again, we've been doing this for 20 plus years with our child care minimum standards. Here's one thing in the guidance that I wanted to make sure I pointed out to you. When we talk about feeding children, so holding, washing, or feeding a child, so your infant toddler teachers right here. After you feed a child, make sure that you're washing your hands and your neck, all right? Because a lot of times the child will touch the neck whenever you're holding them and you're feeding them. So you're washing your hands, your neck, and then any other part of your body that may have gotten bodily fluid on it. So the child's bodily fluid, you want to make sure that you're washing that. So it's not just hand washing in those infant toddler classrooms, but remember the neck and then any other skin that has been exposed to bodily fluids. Now, the recommendation that we've been following for the last year is to encourage your infant toddler teachers to wear long sleeves, all right, to reduce the skin-on-skin contact, all right? And I know that, children need that skin-on-skin contact, but this is where you just got to weigh out the risk, all right? What is the greater risk right here? We want to protect all of our individuals from getting sick, all right? All right. I see a question about what if you have siblings that are in different classrooms? Do you have to quarantine both classrooms? Melinda, that's going to be a question for your local health department. And if you have a exposed child or a child that tests positive, they're going to give you guidance on that. All right. And it's going to go back to the more than 15 minutes of time within the 24-hour period. That's what they're going to look at right there. We've been encouraging parents to bring multiple changes of clothes, not just one extra set of clothing, but multiple changes of clothing, so that if a child gets bodily fluid on their clothes, we're going to change them immediately, because the more bodily fluid that is on the child, the more at risk all of the other children and the adults are going to be. So when you do have a child that drools or has a little spit up and they get bodily fluid on their outfit, we want to make sure that we're changing those as quickly as possible. All right, so that's in there as well. It is going to talk on page 6 of the guidance about wearing a mask. All right, and so I know we've already mentioned mask at the beginning of our webinar, but everyone 2 years and older should wear a mask covering both their mouth and their nose when they are around people that do not live in the same household as them, except when they're eating or sleeping. So at nap time, make sure they're taking that mask off. I've actually seen this visiting a program. I saw children laying on mats with their mask on. We don't want them to suffocate, so we want to make sure that we're taking that off. All right. Another big part of the guidance that you're going to see here is that masks do not substitute for physical distancing. So you should still wear a mask even when you're practicing physical distancing. All right. So a lot of times, you know, I see people they'll back up and they'll stand 6 feet away and then they'll lower their mask. Oh, I'm not within 6 feet. You still, the mask, the physical distancing does not replace the mask. So that's important to communicate with your team right there. After you remove your mask, make sure you're washing your hands. All right. I thought this was some really interesting guidance right there too, because we're touching all kinds of stuff all day long, and then we go and we start touching our mask. All right. So if we do have some exposure on our hands and then you're going and you're touching your mask, now your mask is exposed. All right. So making sure you're washing your hands before and after applying your mask, that's a good recommendation right there for you as well. On page 6 of the guidance, something else that I really want y'all to pay attention to is that face shields and goggles. The CDC does not recommend using face shields or goggles, and face shields and goggles do not substitute wearing a mask. All right. This is something that, you know, probably I want to say it was May or June or July of last year, they kind of reversed their decision on this. That I see a lot of people wearing a face shield but no mask. You got to still have the mask on right there. All right. It's going to, again, continue to talk about good communication. So lots of signs, a lot of messages. We want visuals. Visuals never get tired of telling us what to do. So you want to have those visuals on your front door, within your classroom, all of that. Something I meant to say at the beginning of the webinar, but it's going to come up right here as well. You're going to see a lot of words like consider, and words like recommend, and words like guidance, and all of these documents, all right? Guidance and recommend and consider. Those are not requirements, all right? So we kind of need to go back to, you know, grammar class where we look up words in the dictionary. Y'all remember having to get the dictionary out and write the definition of words back when we were in school? Well, there's a big difference between consider and recommend and guidance versus requirement. All right. So once again, that's where we're going to do the best we can with what we've got right here. All right. There you go. Again, it's going to continue talking about using your disinfecting buckets in all age groups. So when a child is playing with a toy, after the child gets done playing with the toy, you put it in your disinfecting bucket and it's set aside. Your employees are going to sanitize this toy, allow it to air dry before it's placed out for another child to play with it. We've been doing this for the past year. We should have this down by now, all right? It's also going to talk about avoiding using shared items. So we want to make sure that each child has their individual container that's got their own individual art supplies, sensory items. We want to make sure they still have sensory items but not shared. So each child has their box and you're using that. So depending on what age group, the size of the box. And I got all these at the dollar store. Did not cost us a whole lot of money. So we're going to continue this practice, all right? This is probably one of the practices that even when the pandemic is long gone, we're going to continue doing this. Because I don't know about y'all, but having each child having their own bucket of supplies has worked really well for us. And we've seen a big reduction in some of our consumable costs because of that. All right. I'm just kind of reading a comment. So I got a question. If a staff member has their mask off while eating and the child needs immediate attention and the staff forgets to put their mask back on and licensing walks up, could you be cited for that? Well, I don't have a crystal ball, so I don't know how your local licensing rep is going to interpret that situation, so I can't answer a definite yes or no. Hopefully your local licensing rep is going to be considerate enough to know that, this was a circumstantial thing, that it was an immediate attention, and they're going to, be human when they make that call. But could you be cited? Sure. Could they say, hey, this was a circumstantial situation? Probably so. All right. One thing you're going to see in the new guidance that has come out here in March is they're going to talk a lot more about ventilation and making sure that when it is safe to open windows, that you're getting as much fresh air into the classroom and into the building as possible. So when it is safe to open a window, when it is safe to open a door, we want to get that fresh air in there. Now, my whole thing is that always make sure there is a screen on any window that you open. We don't want children escaping from the building, through a window with no screen on it. We definitely don't want a child falling face first out of a window out of your building. So my rule in my world is that there has to be a screen on the window before it is open, but that's something that you can easily accommodate right there. They're also going to talk about when it is safe to do so. Let children eat lunch outside. So if you've got picnic tables, that you can take the children outside for snack and for lunch, that is a recommendation that you're going to see here. The more we can get them outside, the more fresh air they're getting, the less likely there's going to be an exposure. Now, here in Texas right now, it's the end of March. We've got April, we got a couple of weeks in May, where yes, we've got some really nice weather, and we can probably open our doors and our windows, and we can probably do snack and lunch outside and have some really good positive experiences. By mid-May, you're melting. All right, so, we're going to do the best we can with what we've got at that point right there. All right. Once again, they're going to talk about making sure that your chemicals are not within children's reach, but you are using your disinfectants and sanitizers as directed by the manufacturer. Make sure that you're not supersizing because you are afraid that someone's going to get sick. So we supersize our chemicals. Don't do that, because that can cause lots of other issues. Same thing, keeping children's bedding separate and not cross-contaminating. This is no different right there. We've talked about sanitizing the toys. No difference right there for you. All right. On page 8 of the recommendations or the guidance from the CDC that I wanted to point out to y'all right there. It says consider turning on your HVAC system 2 hours before opening and then leaving it on 2 hours after you close. So once again, you're getting your building nice and ventilated and that air moving around. So I know a lot of you program your thermostats to go on and off, at opening and closing time. You might want to readjust those thermostats to consider 2 hours before opening and 2 hours after you open right there to keep that ventilation going. All right. I see a question. Yes, the masks are recommended. You can't be really cited by licensing for not wearing a mask, but pretty much every document that we have here, the governor's health protocols, the emergency orders from the governor, the CDC recommendations are going to encourage and guide you to wear masks, all right? So you want to avoid the risk and the liability, all right? So you should be wearing your mask right there when it is feasible. One thing you're going to see in the guidances that came out in March right here is they're going to talk more about children with special needs. And I was actually pretty happy that they added this in here, that they're going to talk about making considerations for children with special needs, that when you do have an employee that is wearing a mask, if you have a child that has a special need in your program, wearing this mask could be a greater risk for the emotional state of that child than not wearing the mask, all right? Because children with special needs, they need to see our face. They need to see the eyes, the lips, the facial expressions. That's very important for them. And if you do have a child that has signs and symptoms pointing to a special need, and your caregiver has half of their face covered, that could be emotionally damaging for that child. So you're actually going to see in here that they're going to tell you to take that into consideration. So when we go back to the mask once again, if you have a child in your program that does have those signs and symptoms of a special need, that might be a circumstance where the mask is removed. Because you're going to see several times throughout this document that you got to weigh the risk. What is the greater risk right here? All right. The risk of exposure, which for children is very, very minor. All right. When we talk about the risk of exposure, it's more about the adults that we need to be taken into consideration. But we really need to focus on the social and emotional state of the child. And the mask and wearing the mask could have an impact on their emotional state. The hand sanitizer and the other chemicals that we're using in our program and that overwhelming smell of the chemicals could have a big impact on the children with signs and symptoms of special needs. So you got to take those things into consideration as well. So I was happy to see that they put that in there. Something else that I wanted to point out on page 9, I'm kind of bouncing around a little bit, I apologize, is that making sure that you have a healthy supply of water. And it is recommended that parents send in water bottles for their individual child to avoid using water fountains and faucets that could have cross-contamination. And especially if your program has been closed for a while, if you're one of the programs that you did close during the pandemic, or you were forced to close during the winter storm, or you had to quarantine and you closed your program for 10 to 14 days, your water has not ran in 10 to 14 days, and then you suddenly reopen and you turn that water back on, you've got a big risk of some harmful chemicals or whatnot being in that water. We want to make sure we've got a healthy supply of water for our children and staff, so they're actually recommending water bottles, all right, that is sent in from home for that individual child. I thought that was a good recommendation too. On modified layouts, this was something else that I thought was very interesting. Now, we've talked over the last year about physical distancing, and whenever you're putting children at a table, to do every other chair to allow space in between each child. They're actually recommending here that you only use one side of the table, all right? So you're just going to have children sitting on the left side of the table, and no one is sitting on the right side of the table, because we spread our germs when we're talking forward. And so as the children are eating and they're talking, the spitting and the body fluids are going out forward, not side by side. So they're recommending to avoid having children sit across from one another so that you don't have that exposure. Kind of makes sense, doesn't it? All right, so it makes sense right there. All right. I see, Monica saying, what if you are washing the water bottles after each use? I mean, that's acceptable for sure, as long as you're sanitizing and washing those water bottles after each use. The concern here is that if your water has not been used on a regular basis, so like if your center has closed down and you didn't have water flowing through your pipes, you could have some unhealthy water right there, all right? But it's also the cross-contamination. Take it for what it's worth and do what's best for your program right there. All right, make sure that we're still using physical barriers and guides, so stickers on the floor, tape on the floor, reminding children to stay 6 feet apart from one another when lining up, using circles on your circle time rods to try to keep a distance between children as much as possible. We're still going to continue to do that. Like I said, visuals are wonderful. Visuals never get tired of telling us what to do. All right, someone said, oh, this is cracking me up. What if they turn their head and cough? I just encourage y'all to kind of take this serious and think practical, that we're trying to do our best to keep our children and our staff safe and healthy. All right? If you make a joke about a lot of this stuff, then you're not setting a good example for your staff and your parents, all right? We need to really be thinking outside of the box and ways that we can keep everyone healthy. It makes sense to make sure that you're only using one side of the table, that you're reducing the risk of bodily fluid going across the table, all right? Can someone turn their head and cough? Of course they can, all right? We can't protect everybody, all right? And that's just, this is a whole nother conversation right here. With this whole pandemic, at some point, people have to take responsibility for their own health and safety, all right? We can't continue to rely on other people to keep us safe and healthy. And at some point, we have to rely on ourselves to make healthy decisions and decide what is healthy and what is not. And I think here in Texas, especially, we're really moving in that direction, like the mask mandate and the governor lifting the mask mandate, all right? And I know there's a lot of people that are upset about that, especially in the service industry, and I get it, I understand it. But like I said, at some point, people have to take responsibility for their own health and safety, all right? Our young children are not there yet. All right, our young children can't take that responsibility. So we've got to make sure that we're following practices to keep them healthy as well. All right. Nothing really different with playground equipment. Of course, really not, a recommendation to go out and sanitize and disinfect your playground equipment. It does say in here to wash your playground equipment and keep it clean, but they're not using the word sanitize or disinfect, all right? Now, if it is a piece of playground equipment that is used by a lot of children in a small amount of time, probably wouldn't hurt to use some sanitizing wipes or something. But you also want to make sure that it stays safe. You don't want it to become slippery and have a falling or tripping hazard out there. So again, you're going to weigh out the risk right there. Once again, in these recommendations, the guidance from the CDC, when you're on the playground, to avoid gatherings where you're mixing children or cohorting children. So we want to continue practicing one group of children on the playground at a time, as much as possible right there. All right. If you are in a situation where you're sharing space, So a lot of you in faith-based organizations, you're in the church and you're sharing space with the church. You want to make sure that you recommend that whoever you're sharing your space with is following all of this guidance, all of these guidelines just like you are, all right? Because when you're sharing that space and if people aren't sanitizing and disinfecting and wearing masks, and you got a lot bigger risk of exposure right there. On page 10, kind of goes back to the question we had earlier in the webinar. Masks should be used both indoors and outdoors by staff and children over the age of 2. So that question came out earlier about wearing a mask outside. They actually have this on page 10 that masks should still be worn. Now again, you need to weigh out the greater risk. If we're doing vigorous activities, vigorous physical activities, we don't want the child to suffocate or to not get enough oxygen into their body. That could cause some problems right there too. So once again, it's kind of a double-edged sword. It's going to be hard to manage this, but you can do it. All right. So yes, even Stephanie, even before the pandemic, I know that those of you that shared your classrooms with Sunday school and those type of situations, this has been a struggle we've had for 20 plus years. The cross-contamination of illnesses, not just COVID, in those shared space situations is hard, all right? So we've been practicing that for a while. All right, nothing really has changed on food service. Once again, there has been no evidence that, COVID can be transmitted through food prep or food service. But where the possible exposure could come from is once again the bodily fluid, just like when you're in the classroom or any other situation. So you still want to wear your mask, pay close attention to hand washing, using hand sanitizer when it's acceptable. Once again, we are avoiding family style meal service. That is in here in the guidance. So we're still not doing family style meal service. And they're still recommending disposable plates and spoons and cups and those types of situations. And I know, for a lot of us, this has increased our consumable supplies. I know I've recommended to y'all way back in the beginning, and I hope you're still doing this, that you're keeping a spreadsheet of all of the added expenses that you've had during the pandemic. So if you are having to buy disposable spoons and cups and plates, and that's not something you normally did, make sure that you're keeping a spreadsheet of those additional expenses, all right? Now, a lot of us have received some additional funding, some grants from local workforce boards, from local counties and cities. A lot of you have the Emergency Disaster Relief Fund from the SBA. Yes, we've had some assistance right here, but I still think it's important for us to be tracking all of the additional expenses that we've had during COVID, and I'm going to talk more about that at the end of the webinar. All right. All right, so we talked about children with special needs. We talked about identifying small groups and keeping children together. We've talked about not mixing. There you go. On page 13 of the guidance from the CDC, I know I'm about to make a few people upset. All right, don't shoot the messenger, okay? It is still going to say that you limit any non-essential visitors, volunteers, and activities involving external groups or organizations. So a lot of your ancillary programs like your gymnastics and your dance and your karate and those type of ancillary programs that we love and we miss, there's still, the guidance here is to not allow them in your program. And that's still in our emergency orders too, all right? So, we we send a lot of well wishes to our ancillary friends. Hang in there, you know, your time is coming, but for now, still not a good idea. All right, there we go. Okay, so it's going to talk about transportation. Now, this is one of those where you just got to do the best you can with what you've got, because when it talks about transportation, those of you that are doing before and after school pickup, it is and this is on page 14 of the guidance. Create distance between children on transport buses. For example, 1 child per seat, and skip every other row. And then what I encourage you to circle right here is when possible. All right, so 1 child per seat and skip every other row when possible. Now that one, I know that's a tough one, because we need to put more than 6 kids on a bus, you know, when we're doing before and after school pickup. Just try to do the best you can with it, all right? But I circled when possible on my notes right there, all right? And we've already kind of talked about, you know, making sure that you're making exceptions for absences in your policies, so that when employees are out more due to an exposure, you know, we want to be considerate of that right there. Backup staffing plans. I know we're all short on staff, but it talks about having a backup plan when you are short on staffing. Just do the best you can. Staff training. Now we're going to talk about me personally, okay? You know, we've been considering what the future of our training business is going to look like. Are we going to continue to do virtual trainings? Are we going to go back to in-person weekend mini conferences and director credential courses? And we miss being with everyone. Well, in the guidance from the CDC, with the March updates right here, they are still encouraging virtual training experiences, and to avoid in-person if possible. But if you do attend an in-person event, then make sure that physical distancing is being followed, make sure that masks are being mandated, all of your normal preventative measures need to be in place for that training event, all right? So, you know, I'm actually working on a national conference right now that's going to take place in June, and we actually just had a meeting on a Tuesday about our national conference, and the whole thing was about how we're going to enforce physical distancing, limiting the number of people in each session, the mask, the hand sanitizer, the whole ball of wax. So virtual training is recommended. If you do attend an in-person, make sure that all of the physical distancing and mask and other recommendations are in place. All right. There you go. They are still recommending the, you know, when you do have a child that has a symptom of COVID, that they are excluded from your program. All right. If you do have someone that tests positive for COVID, 2 to 14 days after exposure, there needs to be quarantining. None of that has changed right there. The screening methods, this is on page 16 of the guidance from the CDC. They are still recommending that parents are dropping off and picking up children outside of the program. All right. So, and that is still in our emergency orders from Health and Human Services. So nothing has changed on that. They do give 2 different screening methods. You know, method 1, that the parent does the screening and then signs off on it. And then method 2 is that you do the screening and taking the temperature. I definitely recommend you be the one that is conducting the screening and not the parent. All right. So there you go. All right. It's going to go into what to do when you do have a person that tests positive for COVID-19. I'm not really going to go into what the CDC guidance is saying right here, because it's actually going to tell you right here at the top, you're still going to follow your local health department guidance. So regardless of what the CDC is recommending, you're going to follow the guidance of your local health department on quarantining and closures and all of that stuff right there, and the isolation. So let's just stick to whatever your local health department tells you on that one right there. And then once again, it's going to go in and it's going to talk about the quarantining and staying away from the program. If you've had exposure to someone more than 15 minutes in a 24-hour period, that's going to come up once again. And like I said, on page 18 is where it's going to talk about, you're going to follow your local health department guidelines right there. All right. Also on page 18, I just want to point out supporting and coping with the pandemic. I know it's been a tough year for all of us. We are all so ready for this to be over with, aren't we? But we still need to be human and recognize that this is hard for some people to cope with. And so we want to be aware of their triggers, be aware of their stress, be aware of their anxiety, and have some resources available for them when you do have a person that's struggling with this, all right? And I know a lot of us have experienced that. All right, now, that's it on the guidance from the CDC, and we went just a little bit over on time, so I hope y'all can give me about 2 more minutes because there's something else I think it's very important to say. The guidance from the CDC, once again, updated on March 12th of 2021. The health recommendations from the governor's office, updated on March 10th, all right, of 2021. Our emergency orders from Health and Human Services are in place until April, but they can be extended until June, all right? So we still have a lot of enhanced practices that we're being required to follow the best we can, all right? And the cost of running our program is still very high, all right? We have a lot of additional costs. Our enrollment is also still down in most situations right here. Okay. Now, for those of you that take subsidized children, y'all know that we have been receiving the additional 25% of our reimbursement, since last summer, and that's been very nice. We're very blessed, and we are grateful for that. However, that 25% is ending at the end of March. And then they're going to start slowly weaning us off of it, taking it down to 20%, 15%, 10%, 5%. And by the end of July, that extra money is going to be gone. All right? But we're still being required to follow all of these enhanced recommendations. If you feel that your center is still being financially burdened by all of the guidance and the recommendations, I strongly encourage you to write as many letters as possible, as many emails as possible, as many phone calls as possible to your local workforce board, letting them know the financial hardship that you're still having with the guidance and the recommendations, all right? I'm worried about a lot of programs with the extra funding that we've been receiving ending and us being slowly weaned off of it because the cost hasn't gone down, all right? And we need them to be able to see that all of these protocols are still in place. The expenses are still there. Now, part of the stimulus package that was recently passed by our federal government did earmark a lot of money to go to child care programs. I'm sure y'all are aware of that, all right? That there was a very large amount of money that was earmarked for child care programs. The federal government will allocate that money to each individual state, and then each individual state will decide how to distribute those funds. We need to let the state of Texas and Texas Workforce Commission know that we are still struggling financially with all of the guidance and recommendations, so that when they make the decisions on how to spend that stimulus money that has been earmarked for child care programs, that it is done in an appropriate way. And I'm hoping that the billions of dollars that have been earmarked for child care, what I'm really hoping and praying for is that 25% additional funding that we've been receiving is going to be extended. All right. I also am hoping that they give consideration to those of you that don't take subsidized children, so you're not receiving that additional 25%. I hope that they take y'all into consideration and they find some way of getting some funding to you, because you need it too. All right. So those of you that don't take subsidized children, so you have not been able to get this additional funding, y'all really need to be writing some letters and making some phone calls, all right, so that they know that you're being left out, okay? So that's important for you right there. All right, hopefully this information was helpful. I bet 99.9% of what we talked about today you've heard before. Probably 99% of what we talked today, you've already been doing it. You've already been exceeding it. So like I said at the beginning of the webinar, most of what is in this guidance for child care programs from the CDC is all part of our child care minimum standards, and most of us have been exceeding this even before the pandemic, all right? But it's good to be aware of what they have in here. All right, so those of you that are wanting a certificate of completion for watching today's webinar, there is a link on Facebook. It's already posted for you to complete your online worksheet. If you are needing that certificate, if you're gonna, there's a $5 fee to get a certificate of completion. There's a link if you're gonna pay with a credit card, or if you have established an online account with me, you can click on the link to pay with an online account number. Most of you have done this before. You know the process. It's pretty easy. Those of you that came in late and you missed the beginning of today's webinar, I encourage you to go back and watch the beginning. All of our webinars are archived on Facebook, so you can click on the tab for videos and you can see all of our past webinars. They're also posted on our website, timthetrainer.com, and then you can go back and watch the beginning of this or any other webinar that you might have missed. All right. So, awesome. Thank you all for being with me today and spending this hour with me and going over the guidance for child care programs from the CDC, and I hope that it's helpful. I will continue to keep you updated on anything that comes up that affects our world, and we'll continue supporting one another and being there for one another. And like I said at the beginning, I'm very optimistic about our future. We're going to get through this pandemic and we're going to be stronger than ever before. So I appreciate all of you for what you do. All right. Thanks a lot, everyone, and I will see all of you next week. All right. Bye.